Hi, Keegan here, talking about health AI. So, health AI bubbled to the top of the list of topics that folks wanted to talk about in some sort of collaborative forum. And so, I'm just going to do a bit here, some ways that I think about health AI in general, and three different aspects of the framework that I use to think about AI in health. So the first is solve a problem. I don't care whether it's AI or a more fundamental technology like an EMR or a billing system. You should be solving a problem. And so this is an issue I see with a lot of technologies where the technology is the thing that people focus on and they forget the thing that technology is supposed to be solving. And just an example here, in the health AI space, there are a lot of ambient documentation. Seems to be an area where AI is getting some traction. It's the process of creating a node and doing proper documentation is laborious, frequently results in pajama time, so time after the visit that's not reimbursed. So why not have something digital do it by itself and replacing a human scribe doing it, or worse, a physician doing it or a clinician doing it after hours and non-reimbursed time. And I wonder a lot if you've seen a record, if you've seen data that a note creates, one of the things you'll notice is poor data quality. And this isn't a knock on clinicians in general. This is a knock on what our system does to clinicians, right? It focuses a lot on documentation for the purpose of reimbursement, documentation done quickly, and this creates a lot of perverse incentives about what actually goes into the note. I had a veteran primary care physician say to me recently, "Oh, great, you've had experience in EMRs, so what, you need to answer this question for me." And I'm like, "What's that?" And she's like, "Why do all the patients look the same?" I'm like, "What do you mean?" She's like, "As I'm like going through patient records, what I notice is that there's a lot of stuff copied from one note to another, and the uniqueness of what's going on with the patient is lost because of this kind of form and template based activity." And I chuckle, "What's wrong?" I'm like, "The reason this is happening is because no one has time, and it's an easy way to get the things done, to get paid and other things." And what I hope is not happening with a lot of these ambient tools is perpetuating that behavior, because the problem that ambient AI should be solving is a data problem. It shouldn't be purely an efficiency thing. And so if we're thinking of AI in healthcare that way, this is really bad, because I spend a lot of time thinking about how to make the record richer, because it's not. If you spend any time looking at the actual data points, if you spend any time looking at even the text of what's created in a record, what you'll find is pretty disheartening. There's not a lot of meat there, and that's not meat used in a coding sense. That's meat used to describe uniqueness of a patient, and we could talk a lot about that. So that's number one: solve a problem. Make sure the problem you're solving is meaningful to the user. So that's one aspect of what we could talk more about there. The second is AI isn't the solution. You are. And by you, whoever is solving the problem, because AI by itself is an enabler. It's a support tool. It should be checked and reviewed, should have governance that does that. The user should be empowered to do that, because if you don't have an architected solution, like for a minute, just forget that. So have a problem to solve, and then for a minute, forget you have technology at all. How would you solve the problem as a human being, even if by brute force? Map it out. Like, what would you do to make this problem better? And then consider how AI or whatever the technology is could help you do it better, right? The technology itself should actually be invisible. The focus should be on you and your problem solving ability and how to make that more efficient. So it isn't the solution, you are. And the third thing that I'll mention in this short, and again, these are things that I'd love others' opinions on. If AI or the implementation of AI, health AI, isn't working, you need more human. This is just a funny way. I don't know if you've seen the SNL skit, you need more cowbell. If AI isn't working, you need more human. It means that you haven't thought about the first two things enough, right? You've tried to use AI to replace a human being, and it's not going to work. And you're going to have dissatisfied users, and they're going to look at this thing, this ambient AI tool, for example, and just say, "Yep, not using it doesn't work." Chances are you need more human in the sense of identifying the problem and actually having a solution mapped out. And then again, using AI as that enabling, almost invisible thing that makes you a better problem solver. So those are the three areas that I'm really interested in diving into with the community. Hope you are too, and hope to talk about it again soon. Keegan, out.